Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Look at aging with a sharper eye. Do not think of it only as wrinkles, grey hair, or birthdays. Think of aging as a slow negotiation between water, minerals, cells, blood vessels, bones, skin, kidneys, and the brain. Ask the first question: why does the body begin to feel older? Not because one single switch turns off, but because many small balances become harder to maintain. Now ask the second question: how can something as ordinary as mineral water enter that conversation? The answer is not magic, it is physiology. Mineral water can support aging bodies because it does two things at once. It provides fluid and it delivers dissolved minerals in a form the body can actually use. In the United States, water labeled as mineral water must come from an underground source and contain at least 250 parts per million of naturally occurring dissolved solids. No minerals are simply added afterward to create the label, so do not treat every bottled water as the same. Read the label, look at the mineral profile, let the numbers speak, but be careful. Do not say, mineral water stops aging. Say this instead: mineral water may support healthier aging by helping hydration, bone mineral balance, cardiometabolic function, digestion, and skin barrier biology. That is the medically responsible way to understand it. Why does this matter now? Because hydration is no longer just a wellness slogan. In a large NIH-linked analysis following more than 11,000 adults over about 30 years, higher serum sodium within the normal range, often a signal of lower fluid intake, was associated with greater risk of chronic disease, biological aging markers, and premature mortality. This does not prove that water alone is a fountain of youth, but it does tell us something powerful. Long-term fluid balance appears to be part of the aging map. So begin here. Do not underestimate what is quiet. The body often ages through quiet losses: less thirst, less total body water, weaker bone remodeling, slower recovery, more vascular stiffness, more constipation, more fatigue. Mineral water is not dramatic. That is exactly why it deserves attention. First, understand hydration itself. Ask yourself, why do older adults become dehydrated even when water is available? Because thirst becomes less reliable with age. The signal that once said, "drink now," may arrive late or weak. Reviews on hydration in older adults describe how aging, medications, kidney changes, disease, heat exposure, and reduced thirst all make fluid balance harder to maintain. Dehydration can affect metabolism, digestion, thermoregulation, kidney function, heart function, cognition, fatigue, constipation, and skin hydration. So do not wait for thirst alone. Build a drinking rhythm. How should you act on this? Place water where life already happens. Put one glass near the bed. Put one glass near breakfast. Put one glass near medication time if your clinician allows it. Put one glass near your walking shoes. Do not create a complicated ritual. Attach water to habits that already exist. That is how behavior becomes durable. Now, why mineral water instead of plain water? Plain water is excellent. Never dismiss it. But mineral water adds another layer: calcium, magnesium, bicarbonate, sulfate, sodium, potassium, and trace elements, depending on the source. The composition matters. One mineral water may be calcium-rich, another may be magnesium-rich, another may contain high bicarbonate, another may be too high in sodium for someone with hypertension, heart failure, kidney disease, or a sodium-restricted diet. So do not buy by brand image, buy by chemistry. Look at calcium first. Why is calcium important in aging? Because bone is not a dead structure. Bone is living tissue, constantly being broken down and rebuilt. With aging, especially after menopause and in later life, bone resorption can outpace bone formation. That is how fragility begins quietly, years before a fracture announces it. Calcium-rich mineral water can contribute meaningfully to daily calcium intake, and reviews have reported that calcium from mineral water is bioavailable and relevant to bone health. One review focused on calcium-rich mineral waters emphasized their role as dietary calcium sources and discussed benefits for bone and broader wellness, while also noting the need for more long-term research. How does it work? When calcium enters the bloodstream, the parathyroid glands do not need to pull as much calcium from the skeleton. In studies discussed in bone health literature, calcium-rich water has been associated with changes in markers such as parathyroid hormone and bone resorption markers after intake. Translate that into everyday language. When the body receives calcium regularly, it may have less reason to borrow from bone. Do not think of mineral water as replacing food, sunlight, resistance training, vitamin D, or medical osteoporosis therapy. Think of it as a steady background contributor. Now look at magnesium. Why does magnesium matter? Because it participates in hundreds of enzymatic reactions. It helps muscle contraction and relaxation, nerve signaling, glucose metabolism, blood pressure regulation, and bone structure. Many people discuss calcium loudly and magnesium quietly, but the two minerals belong in the same room. A mineral water with meaningful magnesium can help fill small daily gaps, especially in people whose diets are low in nuts, legumes, leafy greens, and whole grains. How do you use this information? Read the bottle. If it lists calcium and magnesium in milligrams per litre, compare. A water with very low mineral content may hydrate well but contribute little mineral support. A water with higher calcium or magnesium may become a small daily nutritional tool. Do not guess. Check the label. Now consider bicarbonate. Why is bicarbonate interesting for aging? Because it interacts with acid-base balance and digestion, and it may influence lipid metabolism after meals. Several controlled trials have examined bicarbonate-rich mineral waters. In postmenopausal women, sodium bicarbonate mineral water reduced postprandial lipemia compared with low mineral water. Another randomized crossover trial in moderately hypercholesterolemic adults found that drinking a sodium bicarbonate mineral water with meals for 8 weeks improved several cardiometabolic biomarkers without raising blood pressure in that study population. Ask, how could water affect fats after a meal? The proposed mechanisms include changes in gastrointestinal handling of lipids, bile dynamics, intestinal pH, and mineral interactions. Do not oversell this. Mineral water is not a cholesterol drug. It does not replace statins, dietary therapy, exercise, or medical care. But it may become a low-friction addition to meals, especially when the alternative is sugary drinks, alcohol, or no fluid at all. Now pause and notice something. Aging is often accelerated not by one huge mistake, but by repeated tiny exposures. The drink beside lunch matters. The drink after a walk matters. The drink chosen every evening matters. If mineral water replaces sweetened beverages, that change alone can reduce sugar intake while improving hydration. Why fight aging only with expensive interventions when the daily table still has room for correction? Now move to the skin. Why does skin show aging so visibly? Because skin is a border organ. It faces sunlight, air, pollution, temperature shifts, sleep loss, stress, and internal hydration status. The outer skin barrier depends partly on lipids and water balance. A randomized, double-blind clinical trial comparing different bicarbonate calcic waters in healthy women found that the type of water consumed could influence cutaneous lipidomics and skin barrier-related measures, suggesting that drinking water composition may matter in dermatology research. How should you interpret that? Do not say mineral water erases wrinkles. Say this: hydration and mineral composition may support the skin environment in measurable ways, particularly barrier function and water handling. The skin does not float separately from the body. If the body is underhydrated, the skin is part of that story. Now think about digestion. Why do many people feel more aged through the gut before they notice anything else? Because constipation, sluggish digestion, bloating, and poor appetite can make the whole body feel heavy. Fluids help stool, softness, and intestinal movement. Mineral waters that contain magnesium or sulfate may have a stronger bowel effect in some people depending on concentration. Use this wisely. Start modestly. If a water causes loose stools, reduce it. If you have kidney disease, bowel disease, heart failure, or take diuretics, ask a clinician before using high mineral waters regularly. Now let us become practical. Do this. Choose mineral water based on your goal. If your concern is bone support, look for calcium-rich water. Ask, how much calcium per litre? If the number is high enough, 1 or 2 glasses may make a real contribution. If your concern is muscle cramps, low magnesium intake, or general metabolic support, look for magnesium on the label. Ask, is there enough magnesium to matter, or is it just decorative? If your concern is meals and metabolic support, consider bicarbonate-rich water. Ask, does it contain bicarbonate, and how much sodium comes with it? If you have high blood pressure, kidney disease, heart failure, swelling, or are on sodium restriction, do not casually choose sodium-rich mineral water. Ask, is the sodium level appropriate for me? If not, choose a low-sodium mineral water. If you are older and do not feel thirsty, do not trust thirst as your only guide. Drink by schedule. Sip earlier in the day. Avoid forcing large amounts late at night if nighttime urination is already a problem. Balance comfort with consistency. Now ask the most important, how? Question. How can mineral water become part of an anti-aging lifestyle without becoming a fantasy? Use it as a foundation, not a miracle. Pair it with protein, resistance training, sunlight or vitamin D guidance, fiber, sleep, dental care, blood pressure control, and medical screening. Mineral water works best when it belongs to a system. It is one instrument, not the whole orchestra. Here is a simple model. In the morning, drink a glass to correct overnight fluid loss. With lunch or dinner, choose a mineral water that matches your needs. After walking, gardening, exercise, sauna use, or hot weather, replace fluid deliberately. If you are caring for an older family member, do not simply say, drink more. Offer water in smaller, more frequent servings. Make it visible, make it pleasant. Add a slice of lemon if allowed. Use a cup they like. The body is biological, but behavior is human. And remember, carbonation is not the enemy for most people. Sparkling mineral water can help people drink more because texture makes it enjoyable. But if it worsens reflux, bloating, or swallowing discomfort, switch to still mineral water. Listen to the body. Adjust intelligently. Now return to the central idea. Why can mineral water be beneficial in aging? Because aging increases vulnerability to small imbalances, and mineral water addresses several of them at once. Fluid balance, electrolyte intake, bone mineral support, digestive regularity, meal-related metabolic responses, and possibly skin barrier biology. How can it be effective? Through repetition, not through one bottle, not through a dramatic cleanse, through daily, measured, well-chosen use. The body respects patterns more than promises. So let us close with clarity. Do not think of mineral water as a cure for aging. Think of it as a precise daily support for the terrain in which aging happens. Hydrate before thirst becomes urgent. Choose water by its mineral profile. Use calcium-rich varieties for bone support. Consider magnesium-containing waters when intake is low. Use bicarbonate-rich waters thoughtfully with meals. Avoid high-sodium waters if your medical condition requires sodium control. Ask your clinician when kidney, heart, blood pressure, or medication issues are present. Why does this simple choice matter? Because aging is not only fought in hospitals, laboratories, or pharmacies. It is also shaped at the breakfast table, beside the walking shoes, after the afternoon heat, and in the glass we reach for every day. How do we begin? Begin today with one informed glass. Then repeat it tomorrow. Let the habit become quiet protection. Take care of yourself, and take care of the people sitting beside you. We are learning this together, one topic at a time. See you in the next conversation, with health, warmth, and our whole community moving forward together.